50. Hello, I'm William Herring from Albert Einstein Medical Center in Philadelphia. In this podcast, we're going to see examples of each of 50 imaging signs. We'll discuss the name of each sign or the descriptive term. Try and think of at least one disease in which the finding occurs, and as always, pause your computer or MP3 player as you ponder the cases. Here's the first sign. What's the name of this sign? This is called either the pawnbroker sign or Garland sign. It is bilateral hilar and right paratracheal adenopathy, usually seen in sarcoid, and it's called the pawnbroker sign because it resembles the three balls hanging from the old pawnbrokers or pawn shops. What is the name of this sign? This is the bite sign, which is the gouged out defect seen due to collapse of bone in the head of the femur in avascular necrosis. What is the descriptive term for this appearance? This has been referred to as the Schmoo sign, which is the appearance of the prominent rounded left ventricle and the dilated aorta, and it's called that because it's likened to a comic strip character in a Little Abner comic called the Schmoo, of which there's a picture shown here. What is the name of this sign? This is the bowler hat sign, the cup-shaped filling defect seen on air contrast barium enemas that represents a polyp usually if it points toward the lumen and a diverticulum if it points away. What is the name of this sign? This is the bow tie sign of facets in the cervical spine on a lateral view of the cervical spine in a unilateral rotary subluxation. What is the name of this sign? This is the bulging fissure sign, which is bulging of a fissure, usually the minor fissure, from a very exudative heavy pneumonia, such as that caused by Klebsiella. What is the name of this sign? This is the C sign, seen on a lateral view of the foot in tarsal coalition, a continuous arc of bone from the talus to the inferior cortex of the sustentaculum talus. In the inset, there is a photo of a normal lateral ankle. What is the name of this sign? This is Wimberger sign, bilateral focal destruction of the medial aspects of the proximal tibial metaphyses, pathognomonic for congenital syphilis. There's also periosteoreaction of both tibias. What is the descriptive term given to this appearance? This is a Mickey Mouse pelvis, which is outward flaring of the iliac wings that can sometimes be seen in Down syndrome. What is the name given to this sign? This is the flat waist sign, which is the flattened, straight appearance of the left heart border due to rotation of the heart in left lower lobe atelectasis. What is the descriptive term given for this appearance? This is a feline esophagus, transient transverse esophageal folds seen on a double contrast esophagram, usually normal but possibly due to gastroesophageal reflux. What is the name given to this sign? This is the boomerang sign, which usually indicates infarction of the splenium of the corpus callosum. What is the descriptive name given to this appearance? This is omental caking, infiltration and thickening of the omentum, usually from an ovarian carcinoma, but also from gastric or colonic carcinomas as well. What is the descriptive term given to this appearance? This is the Mickey Mouse sign, which is increased radiotracer uptake on a bone scan in the pedicles and spinous process in a vertebral body with Paget's disease. What is the name given to this sign? This is the insular ribbon sign, blurring of the normal corticomedullary junction in the insular cortex as a sign of early middle cerebral artery infarction. What is the name of this sign? This is the cortical ring sign, a circular shadow cast by a rotated scaphoid in scapholunate subluxation, secondary to the scaphoid's abnormal orientation. What is the descriptive term for this appearance? This is the rachitic rosary, due to the enlarged costochondral junctions of the ribs in rickets, resembling a string of rosary beads. What is the name given to this sign? This is the tooth sign of bone proliferation at the site of the quadriceps tendon insertion on the anterior patella from degenerative enthesopathy. What is the name of this sign? This is the hot nose sign, representing early and increased activity on a radionuclide blood flow brain scan in the region of the nose, especially in individuals with brain death. What is the descriptive term for this appearance? This is picture framing, the box-like appearance of the thickened cortices in the vertebral body in Paget's disease. What is the name of this sign? This is the small bowel feces sign. Seen on abdominal CT, there is heterogeneous solid material containing air bubbles in a dilated small bowel from small bowel obstruction. What is the name of this appearance? This is the string of beads, which is the corrugated or pleated appearance of an artery affected by fibromuscular dysplasia. What is the name of this sign? This is the target sign in bowel, which is the cross-sectional enhanced mucosa and serosa with a more loosened central submucosa due to edema or inflammation of the bowel wall, such as might be seen in Crohn's disease. What is the name of this sign? This is Westermarck sign, which represents a focal or regional pulmonary oligemia seen occasionally distal to occlusive thromboembolic disease in the lung. What is the name of this sign? This is Wimberger's ring sign, which is the denser white line of calcification encircling the osteoporotic epiphyses in a patient with scurvy. Radiology loves its ring signs, and here are the names of 10 ring signs that are used in imaging for you to look over. What is the name given to this appearance? This is the egg on a string sign, representing narrowing of the superior mediastinum and a globular shape of the heart in neonates with transposition of the great arteries. What is the name given to this sign? This is the fallen fragment sign, representing a small piece of bone which settles to the most dependent portion possible of a unicameral bone cyst from a pathologic fracture. What is the descriptive term given for this appearance? This is the light bulb sign, the persistent appearance of an internally rotated humeral head in a posterior dislocation of the shoulder. What is the descriptive term given for this appearance? This is the apple core, the appearance of an annular constricting carcinoma of the bowel, usually the colon. What is the name of this sign? Here's a clue. It's the bird of prey sign, which is the appearance of the tapered end of a barium column in sigmoid volvulus. What is the descriptive term given for this appearance? This is the cobblestone appearance, which is alternating normal and denuded mucosa from ulceration, especially in Crohn's disease of the colon. Here's an example of a cobblestone street. What is the descriptive term given for this appearance? This is the Erlenmeyer-Flass deformity, representing widening of the metadiaphysis, especially in the distal femur, seen in bone-packing diseases such as Gaucher's disease, thalassemia, hereditary exostoses, which is what has occurred in this patient, and Pyle's disease. What is the descriptive term given for this appearance? This is the rat bite sign, representing the sharply marginated, overhanging, bony erosions usually associated with gouty arthritis. What is the name given to this sign? This is the corduroy sign, the vertically oriented and thickened trabeculae seen in a vertebral body which contains a hemangioma. What is the descriptive term for this appearance? This is whiskering, the irregular bone growth at the sites of tendinous insertions, enthesophytes, seen in diseases such as degenerative arthritis, diffuse idiopathic skeletal hyperostosis, and the spondyloarthropathies. What is the name of this sign? This is the falciform ligament sign, which is visualization of the usually invisible falciform ligament on the anterior surface of the liver from surrounding air in a pneumoperitoneum. What is the name of this sign? This is the signet ring sign, which is a dilated bronchus becoming larger than its accompanying pulmonary artery, seen on chest CT in bronchiectasis. What is the name of this sign? This is the split pleura sign on CT, representing the contrast-enhanced visceral and parietal pleurae divided by a less dense empyema. What is the descriptive term for this appearance? This is the corkscrew sign, also known as the spiral sign, which is the spiral appearance of the fourth portion of the duodenum on an upper GI in children who have midgut volvulus. What is the name of this sign? This is the reverse 3 sign, which is the appearance of the inner margin of the duodenal loop from an enlarged head of the pancreas, with tethering at the ampulla, shown by the white arrow. What is the descriptive term for this appearance? This is a target calcification, a central or bullseye calcification seen most often in histoplasmomas. What sign is depicted here? This is the cervicothoracic sign, in which a mass, which extends above the clavicles on a frontal chest radiograph, can be presumed to be located more posteriorly in the chest. What is the descriptive term given to this appearance? This is the crowded carpal sign, in which there is overlap of the distal and proximal carpal rows in a perilunate dislocation. The inset shows the normal appearance of the carpal bones. What is the name of this sign? This is the cockade sign, which occurs in intraosseous calcaneal lipomas with central calcifications, resembling the badge generally worn upon a hat. What's the name of this sign? This is the drooping shoulder sign, from inferior subluxation of the shoulder, seen most often in flaccid paralysis, as would occur with a stroke. What is the name of this appearance? This is a faceless kidney, representing obliteration of the normal renal sinus, first described with duplications of the kidney, but now also seen in neoplasms or inflammation. What is the name of this sign? This is the spilled teacup sign, the appearance of the volar displaced concave surface of the lunate in a lunate dislocation. What is the name of this sign? This is the football sign, the oval-shaped lucency representing a large pneumoperitoneum